I'm Dr. Arjun Handa, plastic surgeon and body contouring expert at Handa Aesthetics and Plastics. So let's talk about arm liposuction. So why is arm liposuction so popular in our country? Well, our apparel and our natural attire, our ethnic attire involves wearing sleeveless clothes. And in those sleeveless clothes, obviously the arms are going to show. So whether a person is fit or not is often determined by looking at their arms. And especially for females, arms become a source of primary concern because it is them who wear sleeveless half the time. So arms having a lot of fat or loose skin usually troubles them a lot, and if they can't wear sleeveless apparel, then it usually poses as a problem for them, for which they come to us to get it corrected. Arms are also a very important indicator of a person's health. If a person has flabby, loose arms, usually we tend to associate it with high weight, bad body mass index and obesity and overweight population. If the arms are athletic, they are thin, then the person, irrespective of their weight, usually look thinner. That is why a lot of cases that we do are arm liposuction rather than whole body liposuction. And whenever we do whole body liposuction, patients usually want arms to be done at the same time. So let's talk about liposuction. What is liposuction? How is it done? What are the different technologies? So liposuction is a procedure in which we make very small incisions like 3 to 4 millimeter in size. After that, we take the fat out. There are different technologies like power assisted liposuction, in which we simply put some fluid in to decrease the blood loss, to wet the fat so that there is less trauma when we take it out, and then we simply suck it out with the help of a machine which kind of cuts the fat into small pieces. This is quite traumatic, and to overcome this, there is another technology known as ultrasound assisted liposuction, one of which is Vaser. So using Vaser, we essentially melt the fat before we take it out so that we don't need to cut it out. It becomes soft, it becomes liquid, so that after the Vaser, when we suck it out, there is minimal blood loss, there is minimal trauma to the overlying skin and to the underlying muscles. Anyhow, whether it is power assisted liposuction or Vaser, that is ultrasound assisted liposuction, usually the results are determined by the plastic surgeon who is performing it and the amount of skill that he has. So let's talk about who is a good candidate for arm liposuction. So in any case of liposuction, two criteria are very important. One, the skin quality, the other, the muscle tone. If the skin quality is good, then liposuction can be done. Because if the skin quality is bad, there are a lot of stretch marks, it's saggy, it's loose, it's wrinkly. After taking out the fat, the skin is not going to settle back onto the muscle, it is going to sag down. So before you undergo arm liposuction or any liposuction for that matter, ask your plastic surgeon whether your skin quality is good. The other thing which is of primary concern is the muscle tone. If the muscle tone is good, then the results are better because the skin adapts to the natural contours of the muscles in a much more natural way. So usually we ask the patients to exercise a little bit surrounding the procedure so that their tone improves. But just be careful in understanding this, because we don't need bulky muscular arms to give a good result. We just need the underlying muscle tone to be good, because the recovery is faster, the results are better. So even simple exercises like push-ups or maybe isotoning exercises like just pushing against a wall are good enough to increase your tone. You do not need to do heavy exercises to get a good result. So let's talk about post-operative period after arm liposuction. In the post-operative period, just like with any other form of liposuction, you have to wear a compression garment. This compression garment is like an arm sleeve which has to be worn 24 hours a day, 7 days a week for a month. It cannot be taken out because the amount of swelling that occurs in the proximal arm is just too much, and this compression garment helps you in containing that swelling. The other thing in the post-operative period which is mandatory for my patients is to undergo lymphatic massages from post-op day 4 to post-op day 14. Lymphatic massages greatly enhance the lymphatic flow, decrease the swelling, decrease the pain, they ensure smooth and fast recovery. If the patients tell me that they cannot wear the compression garment or they cannot undergo lymphatic massages, I tell them not to get it done and tell them to come to me when they are ready for it. Apart from that, in the post-operative period, pain usually lasts for about 5 to 7 days, after which there is usually no discomfort at all. As far as return to work is concerned, if you have a sedentary job, if it's a desk job, you can return to work the next day. On the other hand, if you're doing manual labor, or you're a gym trainer, or you have to go to the gym, or you are doing outdoor activities, I usually tell them to wait for at least 5 to 6 days before they return to work, because upper limb is a very essential component of our body when it comes to performing tasks. And if there is going to be pain and discomfort during that time, they'll not be able to do it. So usually if you're going to be using your arms a lot, then wait for 5 to 7 days. Apart from this, it's a day care procedure. You don't need to get admitted in the hospital. There are no extensive investigations required. You can get it done in the morning and go home in the evening. In fact, most of my cases are done under local anesthesia. General anesthesia is not required except in certain cases. So that means that I don't even need my patients to stay in the hospital for post-op monitoring. Usually they come at around 10 or 11 in the morning, get it done, and they are back home by 2 or 3 in the afternoon. On the other hand, even if it's done under general anesthesia, usually I send them back by 5 or 6 in the evening. This is a 26-year-old female who is fit enough. She is not very fat, she is not overweight, her body mass index was normal. But she said that despite going to the gym, performing exercises, she has these flabby arms and she does not like the fat, especially in the proximal part, that is in the part of the arm which is near to the chest. Usually it is this part which bothers my patients a lot. Distally they say it's usually fine, but the proximal part which is flabby and loose because of the fat, they feel that it bothers them a lot. So when we are doing arm liposuction, we are going to make at least 2 holes. That is, one small hole is made near the elbow crease. So usually it's hidden in those creases and you don't need to worry about any scar. The other one is in the armpit from the front side. So you don't need to worry about it as well, because it's a very small 3 to 4 millimeter mark which is inside the armpit, and about 5 to 6 months it usually disappears. So we did a high definition arm liposuction for her, and in the post-operative period you can see that now this part has gone completely in. There is a beautiful S-shaped curve which has been given, which signifies healthy and chiseled arms. Also, I have defined her deltoid muscles, her biceps and triceps, so she looks a little athletic because she goes to the gym and she wanted that athletic look. Even on the other arm, you can see the shadows and the natural curves beautifully. This is all a job of 1 hour. It is not an extensive procedure. There is minimal blood loss, and as I said, there is minimal pain. And in the post-operative period, again, there is not much discomfort. So you get this result after a 1 hour procedure, and the results are guaranteed because we are physically taking out the fat. There is no question of whether if the results will come. They will come because we have performed removal of fat physically. Another case of mine where a female who is 40 years old, good skin quality, there are no stretch marks, it's tight, it's nice. But again the same problem that she has some fat in this area of the arms where she feels that she's not been able to get rid of it. Again we did a liposuction, and as you can see, a very small marks are made to take out the fat, and then beautiful features are given on the arms, the muscles are defined, the arms look athletic at the end of the procedure. The next question which patients usually ask me is, how long are these results going to last? Well, the answer is it really depends upon the patient. If you work out, if you maintain your diet, if you maintain your weight, then the results stay for as long as you want them to. In fact, if you want to hypertrophy or build up your muscle in the future, then the results even get better. So it is up to you whether you want the results to stay same or even get better. On the other hand, if you do not watch your diet, or if you do not watch your weight, then the results will gradually disappear as you put on weight. So the slimness of the arms will remain, but the high definition features where we have chiseled out the arms, the muscles definition is brought out, that result will be lost if weight is put on. So it really depends upon the patient. If the patient is motivated enough, they can carry this result for the rest of their life. Thank you.